It is an alarming fact that the suicide rate among vets is nearly 4 times the national average, double that of doctors or dentists. Findings from BVA surveys have revealed high rates of dissatisfaction caused by pay rates, long hours and stress. In this report, we look at support initiatives that are reaching out to the disaffected and addressing the mental health issues affecting the profession.
Stress? What stress? From the outside, the world of the vet can appear like the perfect job. Surrounded by animals all day, what is there to worry about? But this is a profession with a suicide rate 4 times the national average, and the pressure builds from day one.
The minute that you graduate, you're a qualified veterinary surgeon, and the clients potentially expect you to perform as well as somebody who's been in the job for 10 years. And you're juggling a lot of different challenges. When you're in practice, you've got this case, and the case you saw 10 minutes ago that's in the back having some blood tests taken, the case you're going to operate on later that's playing in the back of your mind, the client who rang you 15 minutes ago really worried and can you ring her back as soon as possible.
Robin Hargreaves became involved with the BVA through the recent graduate support scheme to help young vets. He's also supporting the new Mind Matters initiative set up by the Royal College of Veterinary Surgeons to tackle mental health problems.
I think there's still an issue that people don't think that it's them. And a lot of the case study people that I've been talking to say, well, I recognised I had a problem, but I wanted to sort this out myself. So we need to sort of change that feeling. But I think the more we talk about the issues, the more conferences there are, the more people are talking about mindfulness and cognitive behavioural therapy, and it will become more and more normal for people to seek help in the same way they would if they had an obvious physical ailment.
Mind Matters is already backing the Vetlife Helpline, using some of its £1 million budget to fund a live answering service. The result is that all vets and nurses have somewhere to turn 24 hours a day, 365 days a year.
When people call, they don't need to give a name. And you can talk for as long as you like about anything that's affecting you. It doesn't have to be a veterinary related issue. We get calls from vets, vet nurses, vet students, people who are concerned about vets.
Recent research by the BVA said that the newly qualified vets who graduated between 2000 and 2009, around a quarter of them had wished they'd chosen a different career path. Long hours, extreme stress and poor rates of pay were all cited as reasons.
Hi, it's really nice to see you again. So as this is beginning of term, just to remind you that we're going to meet for an hour and a half every fortnight for reflective practice.
Peer supporters are one way the University of Liverpool is trying to get its veterinary students to talk through their problems.
The students who work with me have 30 hours of training on, high-level listening skills, communication skills, assertiveness, risk assessment, that kind of thing. And then once they're trained, they advertise themselves within the vet school as peer supporters.
One of the common areas of conversation is about the first few months after qualifying.
I think it's partly by acknowledging that it's an issue, making sure that people are aware that first transition into practice in particular is a very difficult time. Things like encouraging people to seek a supportive practice and thinking when they move into practice, when they're looking for jobs, if this practice doesn't feel like it's going to be supportive, then maybe that's not the right place.
The message is clear: talk early and talk often. Whether you're a student, a graduate or a veteran of the profession, no one is immune when it comes to mental health.